today Dr. Google is accessible to anyone and everyone with the smartphones in hands of most of our population. Dr. Google is something which is available to everyone. And the problem here is that when you start consulting this Dr. Google, why do we have to go to Google to look for a healthcare advice when we have somebody to care for us with a heart and a soul? And that's what we are going to hear from Hema Divakar, that do we really need, or what, impact or disastrous impact, rather, I would say, this practice of using Dr. Google does on our health or can do on our health. So thank you so much, Dr. Hema Divakar, for joining us back today on this first day of Gratitude Marathon. We had a wonderful beginning of this initiative. I can see Dr. V. Padma also. I'm hopeful she's listening. That we had a wonderful day, and we heard some very insightful talks and the words filled with gratitude from all across our industry members and doctors. So I would look forward, Dr. Divakar, now up to you to enlighten us and our audience today that why we need to be more careful with this Dr. Google.
Namaskar again. We stand in an attitude of gratitude, not only to all the viewers who have showered so much love and their expression of gratitudes all through the day on the Facebook, and of course to Kamal Narayan and the IHW, the council, which has done a great job of putting us together. Because just in the previous panel, which was a brilliant panel, by the way, to connect and collaborate, that seemed to come across as a very, very strong philosophy, because each one of us in our own silos are doing our own little things and nobody has seen each other's perspective, and the synergies can catapult into so much, and the catalyst has been the IHW Council. So thanks once again. So coming to the main deliberation, which I have been asked to place my thoughts on, the host has disabled the slide share. So if you can ask Himani to kindly permit us to share the slides.
Himani, can you help if the slide share?
Yes, sir. It's done.
Yeah, I think she has done.
Yeah. So we are here talking about a topic which is about Dr. Google. So very familiar to everybody, just about everybody. Age, caste, economies, no bar. Somewhere, sometime, you would have touched upon the Dr. Google to find out more. So how did it happen that Dr. Google started becoming more trustworthy than the actual doctors with a heart and a soul? This topic is very well placed because the heart and the soul is something which Google can never have. And that is the distinct difference between Dr. Google and ourselves. Because when we dream of becoming doctors, the DREAM for us is D for dedication, R for responsibility, E, the education, which is not only a formal medical or a postgraduate education, but it's a continuum of education by the minute, by the day, by the week, by the months, because that much information is pouring in and we need to update to do our best. And our attitudes. Yes, we know we are wading through a crisis of the COVID-19 pandemic, but we are also wading through a crisis of an attitudinal change from the patients towards doctors and the doctors towards patients, and generally everything that is to be a congenial or a favorable atmosphere. Sometimes there is a plus and minus, and it's all about attitudes and motivation. Just as we heard in the previous panel, what motivates us to keep going and believing in ourselves and trying to do our best? We are in competition with none other than Dr. Google himself. So not that Google can answer all the questions. What you can see in the picture is Dr. Divakar, and he keyed in how to handle a wife. And the Google says, we are also still searching, right? So there are some unanswered questions which fox the Google as well. And many of the cartoons in the present era show that the doctors will put up the certificates alongside their formal medical degree, saying, please do not confuse your Google search with my medical degree. And this is another very popular cartoon on the Guru Purnima day, where it comes across as, Dr. Google, I thank you for everything, because the search I put and what you give me is an unconditional sea of information. Yes, of course, we are talking about Dr. Google, for which many adults, for them, it has become a de facto primary care doctor. Who can blame them? Because sometimes in the real world, accessibility, awareness, affordability, all these are constraints for what we call the universal healthcare. And seeing a doctor may often be inconvenient, time consuming, and expensive to justify that your health really needs such an expert opinion. Medicine, believe me, dear friends, is complicated, as complex as the human being themselves. And the online articles often account for the unique context in which the symptoms occur, and it doesn't take into consideration everything. For example, are you a healthy 25-year-old experiencing cough after traveling abroad? Or are you a 65-year-old smoker with a cough that has just started after you've started taking your blood pressure medication? The evaluations are completely different for these two patients, though the search results oftentimes may be the same. So you may be a 25-year-old looking at the diagnosis for a 65-year in that context, and it can all create such a huge panic reaction, and you may need a doctor to treat you for your panic attacks for diagnosing something yourself online. So some popular sites are even more misdirected. The top 10 search for a cough will give you the answer as lung cancer. So this is all about AI. So is Dr. Google the right doctor for you? The bottom line is that only a small fraction, a very small fraction of available health information online is written with the best interest of the readers. Unfortunately, a still smaller fraction of these articles are really, really accurate and well organized enough to afford a layperson a decent chance of obtaining the correct diagnosis with a reasonable plan. So where you go and what you search for may determine where you will land. I thought it was an ulcer, but after reading online, I'm almost 100% sure that it is a cancer. This is how many patients would come to us with a lot of their queries, but we want to place some strategies on record which may increase your odds of finding an unbiased and helpful information. Firstly, whenever you're searching and seeking information from Dr. Google, it's not its fault. You have to pay attention to the author and the platform. The best medical information is written by academic physicians and or hosted by the websites of medical schools or government agencies. So those who end with National Institute of Science and Health, for example, these are some authentic sites which may give you the right information. And there's nothing wrong, because knowledge is power and you need to seek information beyond the four walls of the doctor's chamber. Second is, be suspicious whenever a website recommends a specific medication or a procedure, especially when the site also offers or contains various advertisements for the treatment. Finally, be careful to distinguish the true search results from the sponsored link. Dr. Google, it's not today, yesterday, not necessarily because of COVID, though the traffic has enhanced very significantly, it has been causing health anxiety since way back in 1998. And many patients who are totally hooked on to searching the Google more intensely and believing that all that it says is true have stopped some medications on their own. So we urge you not to stop any of the medications on your own. Internet can link almost any symptom to almost any prescription of the drug. It's easy to convince yourself incorrectly that your fatigue, your headache, your nausea, or other symptoms are side effects of your medication. Though you may be tempted to skip some pills, the unintended consequences can really be severe. We've seen both cases of heart attacks and strokes that have occurred because the medication was stopped without a physician's guidance. If you are unsatisfied with your doctor's diagnosis or plan, and however, you're convinced that maybe your search has yielded you some better questions and better results, it's completely appropriate to ask your doctor those questions, and you should never leave a doctor's office without discussing the plan, or also take a second opinion with somebody who has the heart and the soul. So it also depends on how you phrase the query. For example, does cinnamon treat diabetes? If you put in a search like that, then the words of the articles which contain the word cinnamon, the word health, and the word diabetes will all pop up, and any matching words containing these three will show up high in the results. And the mix of true and false information from various sources, people will take away the impression based on what the consensus in that search result seems to be. So instead of asking a question, does cinnamon help in treating diabetes, you have to just ask, what helps in treating diabetes? Maybe that's a better question to ask. So if you at all are Googling, then you must know what needs to be asked. So on the Doctor's Day, wishing everybody a happy Doctor's Day, all my colleagues, my friends, my juniors, and the entire healthcare provider community who are busily engaged in the art of healing, with the thoughts of helping, and with the caring, especially acknowledged with gratitude today. We urge you to think twice before consulting Dr. Google. Anything under the sun, eye twitching, weird stomach pain, leg cramp, is it a symptom of a serious disease? Beware of the temptation to ask Dr. Google. Believe me, no website can replace a detailed assessment by a qualified medical provider. It has been our endeavor, in keeping with the SDG or Sustainable Development Goals, that we have to reach out to everybody in the community. Being in the women's healthcare space, our tagline is reach every girl, every woman, prevent illness and promote wellness. And that is all about the preventive healthcare. And today the digital technology has actually allowed to do that. We have an access to caring for everybody, and the dreams can come true. Again, the rise of online misinformation. Sometimes we reflect and think we are ourselves to blame, and that's why we have launched the Health for Her YouTube channel, to give some specific, authentic information up to the level that is possible. So it raises your level of awareness, which is so crucial for you to come and seek preventive care. As physicians, we really urge you to take responsibility for your own health, and we understand that you have the desire to search for the symptoms and hit upon a diagnosis on your own before scheduling the office visit. And we also very humbly acknowledge that it is not at all a bad idea to raise these questions ahead of your visit to your own doctor, who would respond to you by the mail, so that ahead of your checking with Dr. Google, many a times when the patients come to me, I explain to them, even with the time constraint that we often have in a busy practice, and give them certain important links or the keywords which they can go and search. And it is indeed each one teach one. Keeping to that philosophy, it's a good thing to do to encourage them to actually probe for more information in the correct sites. I would very humbly state that sometimes the patients also do educate us because it is their problem. They have loads of time. They will go into every nook and corner and get us some newer papers. And there is nothing wrong in mutually, when they say public-private partnership, it also is a partnership between the physician and the patient themselves because both are working towards the goal of a healthy future. So in the SDG goals again, good health and well-being, universal healthcare, access to healthcare, education, and gender equity. Everything is collaged and brought together in the true sense of doing good and making this world a better place. So sometimes when we have patients who point out something and we haven't considered it before, we as doctors also should have an attitude of respect for whatever the information the patient places on our table. And we can always tell them, we will look up and get back to you. Or this is a misinformation because the reason why we are offering this option of the treatment is because of these particular points. So there has to be a healthy dialogue between the patient's family and ourselves, and with ourselves and the internet world, as in Dr. Google himself. So it is essential to marry the digital technology with healthcare and say that they lived happily ever after. So this is, in the nutshell, some thoughts which we have placed, the pros and the cons, the pluses and the minuses of a doctor with a heart and the soul who has that something special. Because when they say, the difference between the food that you eat in the hotel and at home it is spiced with your mother's love. The same way, the care, compassion, and the commitment of the doctors, always striving to see that their patients get through with the best of the outcomes, is indeed the essence of the science and the art of healing. So I urge Kamal Narayanji, saying that I'm totally hooked on to the digital world and the technology. There is a lot happening around Dr. Google. I want to speak about it. And thank you, Kamalji, for obliging and allowing me to place some thoughts in front of your esteemed audience. Thank you very much.
Thank you so much, Dr. Divakar. And you have rightly pointed out that many times when we seek help of Dr. Google, it says what you want to hear. And actually it echoes what we want to hear and may not be giving the right solution or right guidance.